look at the growing controversy over Lyme disease. Most mainstream doctors say the infection exists only as an acute or short-term illness and should be treated that way. A handful of other doctors and their patients disagree. Health reporter and registered nurse Allie Gorman is here with the crux of this debate.
Yes, and this debate is going to be getting a lot of attention this week. A hearing will be held Thursday in D.C. to look at some of the medical guidelines regarding Lyme disease. Meanwhile, a new documentary takes a strong stand saying the guidelines should be changed. We spoke with a local family featured in the film.
I am glad you are here.
19-year-old Jared Shea of Coatesville now uses a device to say hello. His mother Janie says he was an active, talkative kid until at age 5 when he was bit by a tick. After that, she says everything changed.
A lot of really erratic twitching that would go on. He sat on his bed and cried all the time in pain. Terrible headaches.
It hurts.
His symptoms are similar to many other patients.
I'm tired. I hurt.
Involuntary movements.
Brain fog.
I lost the use of my right arm.
Theirs and Jared's story are told in a new documentary called Under Our Skin. Like Jared, hundreds of other patients are diagnosed with chronic Lyme disease by a small number of doctors who believe the bacteria from a tick can stay in the body and cause long-lasting problems. But mainstream doctors say there's no scientific evidence to prove Lyme disease can be a chronic infection. Dr. Michael Buckley of Pennsylvania Hospital isn't in the film, nor does he treat Jared, but he's heard similar stories.
First of all, I feel very badly for the patients who don't feel well.
Still, he doesn't believe Lyme disease is to blame and says treating with antibiotics over months and years doesn't help and can be harmful. But for Jared and others, they say it helps.
We saw the twitching stopped. I think he grew 10 inches and doubled his weight.
The studies, which have now been done a number of times, show that antibiotics do help some people, but no more people are helped with antibiotics than are helped with placebo.
And there's one more argument.
People who believe that people can have chronic symptoms with negative tests think our tests aren't good enough, and we just don't believe that's true.
Janie believes Jared's immune system was too weak to make antibodies to fight the Lyme infection. That's why it didn't show up on lab tests.
It does exist. It doesn't affect everybody the same way.
Jared's father wants the way Lyme disease is diagnosed and treated to be changed. Meanwhile, the Infectious Diseases Society of America is holding a hearing on Thursday to review their guidelines. Janie says if Jared had been diagnosed earlier, maybe his life could have been easier.
In the end, the people who are suffering are the patients.
And one of the main reasons for Thursday's hearing is to look at the use of long-term antibiotics because they're not recommended in the guidelines. They're not covered by insurance companies. At the hearing will be experts on both sides of this debate.
Thank you, Ellie. We'll pay attention to